Good morning and welcome to the Shackin' First Monday Morning Minute.
Good morning and welcome to the Monday Morning Minute. Dr. Shackin and I would love to thank everyone who came down to Washington, D.C. for the International Academy of Mini Dental Implant Symposium last week. It was a wonderful event. We'd like to throw out a thank you to Dr. Dennis Flanagan for being our keynote speaker and all the speakers that attended, and especially to Dr. Andrea Smith, El Presidente of the Academy. You did a wonderful job, and thank you so much for all the input. And I think the educational format was wonderful. If you missed out on this one, you'll have to come to the Academy meeting next year. I'd like to talk to you about our upcoming events here at Shackin' First. On September 16th and 17th, we're going to have an introductory mini dental implant and mono dental implant course. Dr. Shackin will be doing live surgery. We'll have hands-on training, and we'll go over all the information you need to succeed with mini dental implants and mono dental implants. And that is a Friday and a Saturday. And keep in mind, you get 16 CE credits for attending. And then we're heading down to Houston, Texas for the ADA. And we're going to be at booth 1309. So come down and see us. We'll have our motors there. We'll be placing demo implants at the booth. And Dr. Shackin is also going to be giving lectures at the booth. So remember, this is October 13th through the 15th. So if you're in that area or if you're coming down to the ADA, make it a point to stop by booth 1309, and we'll look forward to talking to you. And then we're coming back to Buffalo for our two-day course on October 28th and 29th. Live surgery, hands-on. Dr. Shackin and his group will be up here lecturing on the benefits of mini and mono dental implants. Sign yourself up. It's going to be a wonderful course. Bring your staff members. And then we're going to have our last course of the year on November 17th and 18th, which is going to be an advanced mini dental implant and mono dental implant course. An advanced course on the 17th and 18th of November. So be sure to put us in your schedule and come out and see us. We'll really look forward to having you at one of our courses. So when I was down in Washington last week, I had a lot of the doctors come out and they were asking me a lot of questions about our models, our patient education models. So first off, I want to start with the mono. This is a mono model, and it's in a clear plexiglass heel, and it has 8 mono implants on it. And this is a wonderful model to show patients if they're interested in mono implants. We cement a full zirconia roundhouse bridge onto 8 mono implants. Wonderful to have in your office. When you show the patient this, you put it in the patient's hand, and you get them a real feel for what the restoration is going to look like, okay? Then we also have a fixed zirconia roundhouse bridge with 12 mini dental implants with O-ball abutments on it. Still one-piece implants, but now what's nice about this is this one does not have a pink gingiva on it. It's just the zirconia itself. But we also make one, if you need a little bit of lip support, we make one with the pink gingiva. So you can get these models with or without pink gingiva at the top. Again, it's 12 mini implants, and we cement this model. We cement the restoration right onto the model. And then lastly, I have the fixed on 6 model. Some call it grade on 8. We call it fixed on 6. So this also can be made with or without the pink gingiva. And we use 6 to 8 mini implants on the case, and then it snaps right on, and it's retained with O-ring housings. And keep in mind, we have 3 different types of retention on the O-rings. We have a standard retention, we have a strong retention, and we have an extra strong retention. It's measured in durometers, so we have a 70, 80, and a 90 durometer O-ring housing. So, and that's what we're looking at right here with this restoration. So all of these models are excellent for patient education, and it really helps the patient understand what type of restoration you're going to be doing with either mono implants or our 2.0, 2.5, 3.0, or 3.75 O-ball implants. It's very helpful for the patient to get the model in their hand and understand what you'll be doing. We thank you very much for joining us on this Monday Morning Minute, and we look forward to seeing you next week on the Monday Morning Minute.